Good morning, everybody. We're just going to give folks a couple seconds here as we still see the people signing on. And then we'll get underway. We apologize for a little bit of delay, just working through technical issues, as is typical. Okay, good morning, everybody, and welcome to our Food for Thought Forum webinar, a roundtable discussion focusing on developing a paid family and medical leave benefits program for Maine. I'm Curtis Picard, President and CEO of the Retail Association of Maine. We're pleased to be co-hosting this morning's webinar with the Maine Grocers and Food Producers Association. We're very honored to have the co-chairs of the Paid Family Medical Leave Commission with us this morning. We'll hear a brief background on what brings us together this morning, the background work of the Commission, and its recently published report and findings. Our hope is to make this webinar interactive and engaging. We'll offer an opportunity for questions and comments at the end of the presentation. It will be critical for you all to provide input as the concept continues to evolve. Joining us this morning, we'll hear from Senator Mattie Daughtry, Assistant Majority Leader of the Maine Senate, and Representative Kristen Cloutier, the Assistant Majority Leader of the Maine House. First, we'd like to take a moment to recognize today's series sponsors who have invested in and supported the work of the Retail Association of Maine and the Maine Grocers and Food Producers Association. A big thank you to Hannaford Supermarkets, Poland Springs, Shaw's Supermarkets, Associated Grocers of New England, Altria, Bizzuto's, C&S Wholesale Grocers, Oakhurst Dairy, Hood, and Pepsi.
Thanks, Curtis. Good morning, everyone. My name is Christine Cummings. I'm the Executive Director of the Maine Grocers and Food Producers Association. Thanks, everyone, for taking time to join us this morning. A few procedural notes before we get started. First, all attendees are muted, and we won't hear each other's background noise, and you all will remain muted throughout the webinar. We will have a question and answer period at the conclusion of the presentation. And to ask a question at any point during the presentation, simply move your mouse towards the bottom of the screen, and within the black bar, there is a white Q&A icon. You can simply type your question in the box and click send. As everyone noted, this webinar is being recorded and will be available after the event for interested participants to revisit. And again, with that, welcome to our Food for Thought Forum series. We'll go ahead and turn it over to this morning's guests. And I believe Representative Cloutier, you noted you'll get started, and then we can hand it over to Senator Daughtry. And if you could just provide us a brief background, and we'll let you all take it from here. Thanks so much.
Great. Thank you, Christine, and thank you, Curtis, and thank you all for being here. We really appreciate the opportunity to share the work that we've been doing around a paid family medical leave benefits program for the state of Maine. So we thought we would kick off this morning. I would talk a little bit about the commission that was created to develop this plan. And then Senator Daughtry would give you a little bit more information about the findings and the recommendations. And then we would circle back and talk more about what future steps look like. So as Curtis and Christine mentioned, I am Kristen Cloutier. I represent House District 94, which is part of my hometown of Lewiston. And I serve as the Assistant Majority Leader for the Maine House. And I was fortunate enough to co-chair the commission to develop a paid family and medical leave benefits program with my friend, Senator Mattie Daughtry. And that commission was developed in late 2021. 2021 through legislation, and membership included both Senator Daughtry and myself, Senator Kimberly Rosen, Representative Paul Stearns, and then several folks who represented business interests and also interests of folks who would be most affected by the creation of such a program. And so those included Wendy Esterbrook, who works in HR at LL Bean, and she represented an employer with more than 50 employees. Sarah Bryden, who was a senior lead compliance analyst at Majesco, representing a member with expertise in issues related to family and medical leave benefits. And then we had Drew Drew Christopher Joy, who is from the Southern Maine Workers Center, who was later replaced by John Levitt, who is a business manager and clean energy developer at North Atlantic States Regional Council of Carpenters. And we had 2 iterations of the commission. We'll get to that in a minute. But John and Drew Christopher represented a member with expertise in issues affecting labor and independent contractors. We had Benita Usher from Smooth Transitions, representing a member with expertise in issues affecting elder care. Emily Ingwerson of Ginger Hill Design and Build, representing an employer with 50 or fewer employees. Dr. Barbara Crowley, leader of the Peter Alfond Endowment Program at Maine General Medical Center, and a member with expertise in issues affecting maternity and postpartum care. And then Charles Mitchell of Bayside Bowl, representing an employer in the hospitality industry. And then we also were joined by Commissioner Laura Fortman from the Maine Department of Labor. And so we were tasked with studying paid family and medical leave benefits programs in other states, developing a plan to create such a system in Maine, and to contract with an actuarial to study various programs. And so that led us to an RFP process and our work with Paul Correa and Dan Squire at Milliman. And so it became very clear very early on in our first iteration of the commission that the time required to conduct an actuarial study would prevent us from completing our process by the deadline required in the resolve for our first commission. And that was February 1st of 2022. And so we determined that we would complete our duties as best as we could, including the hiring of the actuarial, but then would request permission for an extension through additional legislation. And so that's what led us to our second iteration. So really spent 2 years developing this program and figuring out what recommendations we wanted to make in the final report. And so that second iteration of the commission was established in 2022. Yes, I said that right this time, and was funded with an additional $300,000 to contract with Milliman, who was the actuarial. And then our membership basically remained the same with that one exception. So Drew Christopher Joy was replaced with John Levitt as a member representing workers unions. And the commission accepted public comment at all of our meetings. We had, I want to say, 13 meetings. Over the course of the 2 iterations of the commission. We again accepted public comment at all of those meetings, but received a full day of public comment in December of 2021. We also heard consistently from national experts on paid family and medical leave, closely examined PFML programs in other states, which included in-depth presentations on those programs in both Washington State and Connecticut. And we used these presentations from experts to frame the potential parameters for a program in Maine, but recognizing that in the end, we wanted a program that was developed by Mainers for Mainers and not a cookie cutter program from another state. And so with that in mind, we decided we were going to develop 2 surveys, one for employers and one for employees, to help us generate useful information about preferences for the commission to consider when designing a program. And those surveys were posted on the commission's website and remained open for just over 2 weeks. And we received more than 700 employee and more than 75 employer responses. And the complete results of those surveys are available on the commission's website. And so all of that work basically led us to the framework which the commission utilized to develop recommendations. And that included answering questions around purposes for which leave can be used, who would be covered, requirements to qualify for benefits, what family members would be covered, how the program would be funded, what percentage of wages workers would receive, the maximum weekly benefit, how long a worker would receive benefits, determining a potential unpaid waiting period, whether workers would be entitled to have their jobs back when they return, how the insurance would be provided, and the organization and structure of the program. And with that, I will turn it over to Senator Daughtry to introduce herself and to give you the details on those recommendations.
Good morning, everyone. I'm Senator Mattie Daughtry. I'm also the Assistant Senate Majority Leader, so I get to be a counterpart with my friend Kristen in the Senate. Also outside of the state Senate, I am a co-owner of Moderation Brewing in Brunswick, Maine. So I come at this with, not only my legislative policy hat, but also as an employer and owner of a small business in Southern Maine. So I'm going to share my screen, and hopefully technology will behave this time, and go over sort of the initial findings that we had. I think there's going to be a little bit of delay as I get this on. Let's see. Can everyone see those slides now? Okay, I'm seeing nodding. So I'm going to just do a really quick overview of the landscape of paid family medical leave, which ties into what we're looking at, and then jump into our recommendations. So just as a reminder for everyone on the call, the US is the only OECD country without a national paid family leave policy. You can read the really compelling quote there from the Women's Bureau for the US Department of Labor. But another way to think about it is that 120 other countries have paid family medical leave, and the US is the only major economy that does not have a program. Maine has its own FML in addition to the federal FMLA Act. Both of them, I'd like to emphasize, as we know, is unpaid leave. So it is different than what we're talking about today. Current Maine FML allows for 10 weeks of unpaid leave within a 2-year period for employees of businesses who have 15 or more employees. And something that particularly resonated with the committee is that 77% of all Mainers do not have access to paid family medical leave, and most do not qualify for unpaid leave. And just to sort of set the stage, 13 other states, as well as Washington, D.C., have already begun to enact programs. As you can see from this slide, it's a variety of different implementation dates, as well as a variety of different areas. One thing that Maine is already behind on, we're an outlier in New England. 4 other states in our sort of region have this type of program. And for many of us who are dealing with really difficult hiring periods, I think, it's really compelling to look at, we're competing against other states that we know are already pulling from our labor pool, and they're already offering this type of program. So Maine's plan. So here are our recommendations that, we sort of coalesced around after 2 years. And the one thing that the 2 sort of headlines I'd like everyone to remember, first and foremost, this is not a bill. This is a tool book. It's a resource that was created specifically for Maine with a large variety of explorations of potential programs and benefits. But our overarching goal for all commission members is we wanted to create a program and have a discussion about making something that is affordable, accessible, simple, and straightforward for all Mainers. And that means for both employees and for employers and everyone navigating this. So for some reason, it just jumped back to all of the slides. So everyone close their eyes while I go back to the beginning of this. Okay, so purposes for leave. One thing we really wanted to do is not create, we already know how hard it is with a lot of existing both federal and state leave laws, that there's a hard tapestry to navigate. We really saw our potential program sort of being the glue or filling in the gaps and wanting to mirror existing law as much as possible to not create additional confusion. So we're saying that you can use this for caring for a new child, whether it's birth, adoption, or fostering, to care for a family with a serious health condition or one's own medical needs, as well as emergencies related to military deployment. We also unanimously agreed we wanted to make sure that safe leave for victims of domestic abuse was also contained within our program. And many other states do this as well, and it fits with a lot of Maine's stated benefits and goals. So employees covered. One thing we heard from all of the research, both on a national, international, and a regional level, is the most important thing you can do to have a quality program is make sure that it's broadly accessible. So thus we voted unanimously to cover all workers. Additionally, one thing that I'm very, very passionate about is self-employed workers can opt in, which would be transformational. Public and private employees would be covered. Now, for anyone who's on this call who currently offers paid family medical leave to their employees, don't worry, we're not trying to take away that plan. First off, thank you. But also we would be saying that private plans would be allowed. So if you currently have a plan, as long as it meets the state standards, you can continue to offer that. And that's something that's been really successful in other states as well. So to qualify, This was an area that honestly was pretty difficult for us to coalesce around because of the flexible nature of, any state's economy and just how much, the valuation of salaries can change. So we wanted the job to be, we wanted the program to be portable, job to job, as well as accessible. We know that a lot of Mainers don't just work one job. Myself, I can count myself lucky that I only have 2 jobs now instead of 4. So we wanted to find a way to be able to capture all of that. So we're looking back over a 4-quarter period. So that means we want to have a set level. You can't just take this on day 1. You have to show that you've been able to earn a certain amount of earnings during the last 4 quarters to qualify. We really struggled to make the exact recommendation because $100 today was not the same as $100 in 1980 and won't be the same as $100 in 2040. So what instead we recommended was creating a mechanism for a number that stays responsive to the economy, i.e. tying it to the state average weekly wage or the consumer price index, and allowing an oversight entity to be able to continue to set what that sort of vesting number is. So maximum benefit periods and intermittent leave. We voted for what we've heard from other states is actually considered a pretty moderate amount of leave. So we unanimously voted for an annual 12-week maximum limit for a particular qualifying need and a 16-week combined limit. So the example we use is, say that you're giving birth. You'd be out on family leave for bonding with the newborn, but let's say that you had an emergency cesarean. So you could also potentially be out for medical leave at the same time to heal from that surgery. So that would be one of those situations where you would be able to have that 16-week combined limit. But for most circumstances, you're looking at 12 weeks. One thing that we looked at that we were really wanting to make sure we found something that was usable for both employees and employers is intermittent leave. We know how hard it is for everyone if you're able to take something in increments of an hour or 15 minutes. So we wanted to say this is not a program for those short terms. This is for those longer leaves for the reasons previously discussed. So we wanted to make sure that you couldn't use it until you're out for a full day. Smaller amounts of leave can be cumbersome for employers to facilitate. And also we think there are other programs, whether it's, PTO or earned paid leave or, programs and policies that your company might already have on the books for those shorter periods of time. So program funding. Employers with fewer than 15 employees would be exempt from making contributions, but their employees would be within the program. So what this means is that the employers on the smaller scale would be able to access a benefit that I know myself as a small employer is pretty financially unattainable for most of us, but our employees would be able to benefit from the program. Employers with 15 or more employees and employees would contribute to the program cost based on a percentage of their wages. We also, we were looking at affordability as sort of the core of this program and, the combined contribution rate. So that's, both what the employer and the employee would pay. We want it to be 1% or less. So one other thing we came to is when we're trying to figure out what the wage replacement was, we looked at 2 different systems. There is a referendum that's out there, which we're happy to answer any questions or talk about the difference between what we're discussing here and what's in the referendum. But one big area is on tiered wage replacement versus flat replacement. So we considered and ultimately rejected the option of a tiered approach to wage replacement. We found that the tiered system did not fit, our goals of simplicity. Additionally, it made it really hard for both employees and employers to calculate the amount of leave. It just added a cumbersome burden for folks trying to figure out what it would cost and what they'd be able to get. As far as wage replacement, we are looking at our state average weekly wage. And I know the number 120 can sound a little bit scary to some folks. But the reason we set it 120 instead of 100 is because Maine actually has a very, very low average weekly wage. And so when you're trying to make sure that this program is meaningful and attainable for everyone, we needed to really find a way that it fit within Maine's cost of living, and 120% fit within those parameters. So here's one area where we didn't vote unanimously, 80% wage replacement. All commission members voted to support an 80% wage replacement up to that 120% of the state average weekly wage. A majority of commission members voted to support a 90% replacement up to 120% of state average weekly wage. I'll get through the slides that shows what this means for an average $50,000 salary. The biggest thing that I want to say again and again is that we all agreed, no matter what that percentage is, anything is better than what we have now in Maine, which is nothing. So we always joke this is a choose your own adventure. So here's a couple contribution models. So here's a sample payroll for an annual salary of $50,000. So on the left, you'll see with the 80% wage replacement, and on the left with the 90% wage replacement. You'll see, the average weekly benefit, is about $100 cheaper than the 90% on the right. So what does that mean for funding it? So one of the things that we discussed was what the employer wage, whether it's a 50-50 cost share or 25-75. The majority of us coalesced around 50-50 with the employee paying 50 and the employer paying 50. But we also considered both a 25 employer, 75 employee, as well as a 60% employee and a 40% employer. As you can see, the left columns are the 25-75 split. You can see the employers paying $2.02. And then if you flip over to the same sort of 25-75 at 90%, it's only going up about 50%. So the biggest thing we wanted to recommend is that the parameters were between 25-75 and 50-50. The other thing that we actually found pretty compelling is that for most salaries, the contribution for either the employee or the employer is under a cup of coffee. There's very few things as an employer that I can offer my employees that are this cost effective with that much of a meaningful benefit to not only them, but also for me for worker recruitment and retainment. So nuts and bolts, the administration, some of the results that we've seen from Department of Labor, is looking at approximately $19 million in ongoing operating expenses. Startup costs, this is a really flexible number. We're still getting things back in now that are saying it could be anywhere from 30 million to 65 million. Our goal as co-chairs of the commission, as well as co-sponsors of the forthcoming bill, is to find the most cost-effective method for the state of Maine. One thing that would set Maine apart from other states and that we are very passionate about is creating a very robust sort of program evaluation and oversight, which we're referring to as the watchdog, to make your Monday morning smiles. On the left, you've got my two canine fiends. On the right, you have Kristen's. Outside of having our own dogs have oversight over this program, we want to make sure that we have a board sort of similar to something like workers' comp, where people would be able to, every year, this board would be responsible for an annual actuarial study of the program, as well as reviewing, data from the program, complaints, looking at how the program's working for Maine, and have the ability to do rate setting and flexibility to make sure that our program is staying responsive to the state of Maine. So those contribution rates we're talking about on the prior slide, if the program's really going well, this is an entity that can help create a cost savings for everyone and be able to lower those contribution rates. I think this is the most important part of the program, and making sure, that we have something that works for all Mainers. So after rulemaking, the benefit is anticipated to launch about 1 year after contributions begin. So we're potentially estimating best case scenario that this program will be starting in maybe 2025 or 2026. I'm happy to get into the benefits, but I think I'm going to skip over those really quickly because we can answer those a little bit more in the Q&A. Wanted to talk a little bit about next steps. I'll put this slide up there with both Kristen and my email address, and kick it over to Kristen if you want to talk a little bit about the tour and our forthcoming bill.
Thanks, Mattie. Yeah, so just to sort of give you a sense of what we're doing in terms of outreach for the program. So we're here with you all today. We've also already done a Zoom with the state board, the board of the State Chamber of Commerce. And Mattie is going to be speaking at the State Tourism Conference in Bangor on the 27th. We are also planning to do a Zoom with the Portland Chamber and possibly a survey of their members. We are planning a meeting with the Downtown Lewiston Association, which represents downtown businesses within Lewiston. We're doing, one of the things that I am personally most excited about is a roundtable with stakeholders of all kinds at the Jackson Lab. And then hoping to attend the HR state conference in May. And then possibly in the same kind of idea as what we're doing in Lewiston, possibly going to Aroostook County and Kennebunk, and Gray, but those events haven't yet been finalized. So we're continuing to solicit public input. That's why we're here today, really looking to hear your feedback and to take it in. And then we're also just willing to meet with anybody else who's interested, and would love to have you all connect us with folks who may have questions or feedback. And basically we just look forward to that work. The bill right now, and Mattie, maybe you can speak more to this, but is with the revisor's office. It is LR9. It's currently being drafted with many of the recommendations that you heard today from the commission. And we're hoping to have it out soon and before the Labor and Housing Committee as quickly as possible.
Thank you, Kristen. Yeah, I would just add that, you know, the bill is being drafted, and the reason we're going out and meeting with everyone is to solicit your input. We have the 2 years of the commission report as sort of the toolbox to be able to look at all of this, or a lens, but we really want to make sure that we're continuing to create a program that's crafted for Mainers by Mainers. So this is your chance to really, you know, share any ideas, concerns, fears, or, you know, if there's something about your business that is unique that you have concerns about, you know, we really want to make sure that we're really digging down into that. We know as lawmakers that sometimes it can be hard to make time to make it to a bill hearing. As an employer myself, sometimes it feels a little crazy bouncing between the two worlds. Kristen knows this with her job as well. So we want to make sure that we are bringing our conversations to all of you, and that we're not waiting for people to come up to the Capitol. And so really happy to answer any questions, but I can tell you, I can go into further detail if anyone wants to know about why I'm passionate about this as an employer, but really we're here to hear from all of you. So with that, I don't know, Curtis and Christine, do we kick it back over you for Q&A?
Perfect. Thank you so much, Senator Daughtry and Representative Cloutier. Certainly a lot of valuable information. We sincerely thank you for taking the time to present to us this morning. And as you noted, a lot of components to still be continued to be discussed. And so excited to hear there will be a lot more opportunity to do so. And as a reminder to you all today, as attendees this morning, if you have any specific questions, you can use the Q&A function within the Zoom. Again, it's the Q&A icon at the bottom of the screen. And we did receive a few questions in so far. One in particular has been answered by Representative Cloutier, but it was a question specific, which I thought may be of interest to other attendees. And it was, what is the state's average weekly wage? And Representative Cloutier has since noted that Maine's average weekly wage was $1,103 in March of 2022, compared to the national average of $1,216, and is the 19th lowest in the nation. So I thought that was pertinent information to the rest of the group. So yeah, we'll go ahead and open it up to questions for folks to go ahead and type below. And in the meantime, Curtis, I know we've received in a few to date, and you and I have some thoughts as we've been thinking about the policy in preparation for this morning.
Yeah, well, first of all, thank you, Senator Daughtry and Representative Cloutier. We really appreciate your time on this. I guess I'll start out, you know, you've kind of indicated that through the commission process, what you've put together is really unique and different than the 13 other states. But is there a state that this program most closely resembles of the other 13?
I would say no, which for good reasons. I think we were pretty robust in our desire to borrow what works from other states. And we were in a really unique position where, you know, Washington State very clearly said to all of us, please don't do this. Please don't do this. This is what we wish we'd known. We're also able to look at a state like Connecticut. They're still getting their program online. They just started accepting claims. And so we've been able to watch that program unfold in real time and be able to learn lessons. So I would say that it's probably, you know, closest to, actually, no, I still think I can't say it's closest to anyone, because we literally did try to make sure that it was unique, because Maine has different demographics than a lot of the other states. I mean, probably the closest is Vermont. But, you know, we're the oldest state in the nation. We have a high amount of small employers. We have a high amount of entrepreneurs and self-employed individuals. And especially with how Maine is spread out and how rural we are and how hard it is to get to healthcare centers, we wanted to make sure we had something that reflected those specific demographics, and with the amount of seasonality and hospitality workers we have as well.
So I'm glad you mentioned Washington State, because we've certainly had some contact with our counterparts there. And we want to connect with them a little bit more deeply once we see the actual proposal. But I do recall one of the things that they cautioned us on is to make sure the program is properly capitalized from the get-go. And I know you've talked about it would probably be like a year's worth of contributions before benefits started being paid out. I think my counterparts in Washington State indicated that actually more time might be needed than a year. Have you guys taken a look at that? And, is Maine's different because we're not capping the wages that are going to be contributing in? Does that make sense?
Yep, that makes complete sense. We were open to a year to 2 years, and this is where we actually deferred to our actuary, Milliman, Paul, I'm totally going to get his last name wrong, and Dan Squire, were our two principals on this study. If you go to the website, we can actually share a link to the committee report. They were able, within their actuary findings, to show that their modeling thinks that we would only need a year to pay in. But this is why we're so intense about wanting to have a very robust, very unique oversight entity, because you might need during rulemaking, there might be some shifts, or even during this bill discussion that doesn't fit with what Milliman modeled, and have the ability to have that 2-year pay-in period. But at the same time, we wanted to make sure that this wasn't something that goes on and on, so that people are getting return on their investment. You don't want to be paying into a program for 3 years before you're being able to access these benefits. One other thing that we learned from Washington and from other states, where they put a firm number in statute, like the contribution rate is going to be X, and it will not surpass Y. They've actually had a lot of trouble going back and changing their fund stability. So we wanted to make sure we weren't putting too many things in that sort of concrete ability, and enable the committees of jurisdiction, and having an entity separate from the legislature able to shift that.
All right. Anyone, any other audience members, if you have any questions, feel free to ask. In the meantime, another portion of this that we've been speaking about here is this particular proposal certainly differs from the referendum language. And we didn't know if you could speak to some of those differences and why this particular bill's language will probably be different, and what those components are.
Yeah, I can jump in and then kick it off over to Kristen. I think one of the some sort of the top line areas where we differ from the current referendum, the referendum has additional job protections for employees that goes above and beyond current federal and state law. We do not have that in our proposals, and it is not part of the bill that's being drafted. We recognize that Maine has some excellent laws on the books, and we don't want to make a further headache for everyone involved. Another thing is intermittent leave. The referendum allows employees to be able to use this program in spans of, I think, 1 hour. Another area is that it has a tiered program versus a flat program, which in certain circumstances can make it much more robust and meaningful for the lower wage folks. But talking to both consumers who are in the states with tiered, and also authorizers and administrators, it's often very complicated. Say you're planning to have a child, or you're planning to have surgery in the next few months, and you're trying to figure out what you'll be getting, pulling in for leave. It becomes quite cumbersome to figure out what you'll be able to access as well. Kristen, I feel like I'm forgetting a few other things.
I mean, for me, I just think it's a lot of people who aren't like in the legislative world may or may not understand that this is not the referendum, that they are two separate things. And so it's really important for me that we differentiate the program that we've created from the referendum, because they are two different things. And there's a lot more room for input in the legislative process than there is on the referendum side of things. So for me, that's the biggest differentiation, is that we're here at the table trying to work with folks to create a program that works for everyone.
And also that the referendum language is set in stone. It's already out there. They've already gathered their signatures for it. And this is, and the coalition who is gathering signatures is actually held off and is hoping to be able to see us in the legislature be able to come up with something. And this gives us a chance for everyone to have their voice at the table and not be passing language that was, written and drafted by, a select group of folks. This is a chance for everyone to have a seat at the table, which I think is really important with a program that it's important. And also for folks who are listening, who have not seen any of the polling, which we didn't really discuss. Paid family medical leave is overwhelmingly popular throughout the nation, but in Maine specifically, there's been 3 polls in the field just in the last year. And all of them have shown that the strong approval for paid family medical leave is between, I think, 70 and 82%. And that's across all party registration. It is just as popular amongst Republicans and CD2 as it is amongst, Democrats and CD1. So the chances of this passing on a referendum are strong. And that's why I think, none of us like working under a deadline, but here's our chance and time to get this done.
The one other difference is administration of the program. So the referendum, I think, says that it needs to be administered by a state agency, which would in this case be the Department of Labor. And we kind of leave that open. States like Connecticut have used a third-party insurance carrier, Aflac, to do their administration. And LL Bean, Wendy Estabrook, who was on the commission, they have PFML programs in various states. And so they utilize both of those models and can speak pretty well to what the pros and the cons of those are.
That's helpful. I'll jump into some of the questions we're getting from the attendees now. And I think the first question, the person kind of answered it for themselves. At first I asked, employees are paying themselves for leave. I missed a beat on the math and operation. And then this person wrote, I understand the pooled resource process now. So I think we're clear there on that part. But the next question is, does this start on day 1 if someone is out, or does it start after 5 to 7 days when the business actually has noticed that the employee will be out for a period of time, like workers' compensation is? I understand pregnancy and adoption are obvious.
Actually, this is an excellent question. So thank you to whomever asked it. One, help me remember one of the other differences with the referendum. We do have a 7-day waiting period for medical claim benefits. The referendum does not. This is actually a huge cost savings for the program and also makes it fit within, mirroring workers' comp. Family leave does not have the 7-day waiting period because that recognizes you never know when you might be a victim of domestic abuse, or, we heard a lot from foster parents that you're not always sure when that fostering placement is going to be coming. So there are 2 separate types of leave within, and I have to emphasize that this is an insurance program. This isn't like other aspects that you have coming out of your payroll. But, there is a 7-day waiting period for medical, unlike the referendum.
And if I could, just to put a fine point on it, I think you guys alluded to it. I think one of our concerns about referendums is, you as legislators, when you get this referendum, only have the option to pass it as is. You can't amend it. So when the referendum language is out there, regardless of whether it's this or some other topic, it's not able to be changed, and voters can only vote it up or down based on that language.
Exactly.
Christine, you want to take the next question?
We do have a few more coming in. Let's see. Will there be choices to opt out or be grandfathered if you have a plan with equal or better benefits or exceptions?
Yes. We love that you're offering a plan. You can keep your plan, keep doing what you're doing, and thank you.
Let's see. The next question is, so many farmers in our state using seasonal employees. Will the 15 or more employees be full-time equivalent or year-round?
So this is something we're trying to get feedback on, and we've actually asked not only the Department of Labor, but also are asking sort of the Federal Department of Labor, as well as the USDA and Farm Bureau, about how best to capture that, because it's not just for farm workers.
Right.
Think of a restaurant, or I think of even my own brewery. If you were to take a snapshot of my business in July, it's going to look a lot different than January. So we really want to find maybe either and have it within existing data. That's the problem. So for example, the Department of Labor doesn't collect hours worked. They only collect earned income. So we have to find a mechanism for us to be able to separate out which employees are rich, but we want it to be sort of the year-round full-time equivalent. We don't want to be capturing, a farm at the height of, harvest season. I raked blueberries. I've been in that position. I know what that's like. So that's what we're trying to make sure is captured, and we're being really diligent in our drafting of the bill. So.
Someone else asked, are other states contributing to this? I'm shocked that businesses and employees are asked to fund this with no state funding proposed.
So there will be state funding. We don't think that this should be entirely the backs of any one individual. All states are funded in similar ways, that there's a state funding portion that typically goes to, administration. Also, startup costs comes from the state funding. And then it's like any other thing. If you look for employers on the call, open your payroll reporting and look at the employer taxes that you're putting out. Look at your, your FICA, your, Social Security, your competitive skills scholarship. One thing that I've used all these models and run through my own payroll. And what I'd like to emphasize is we're talking about the employee portion being somewhere between, 25 to 50%. That's going to end up being less than almost everything else you're paying on your taxes for your employees. So you're going to be doing a much smaller investment than any other program that we are currently dealing with now.
Okay, another question. Am I correct in saying that the funding for this will be collected through payroll by the employer over time? How do you see the mechanism working for the payout of benefits and how the employer is involved?
Ooh, great question.
So with the exception of startup costs, yes, that is correct. And then Mattie, do you want to take the last piece?
Yeah. So this is one thing that I'm really passionate about getting out there, because I think there's a lot of apprehension from folks that they think as an employer, you will now not only be the employer, but your HR leave specialist. We are not expecting employers to do this. It will go through your payroll. So if you are doing your own payroll, you will be having to make that, allowances that you do for other current programs. If you use a payroll administrator, they'll be taking care of it for you. One, no one can just take leave. This program is not like PTO. This has very specific purposes for which a claim can be issued. And that claim that an employee is making will not be going through you. It'll be going through the administrator. So think of this just like your insurance program for anything else, whether it's health insurance, whether you currently offer short-term, long-term disability, it's going to be that same mechanism that the employee will be making the claims to the administrator, not to you. They still have to check with you as the employer when they're going through this process. And, you have to make sure, we are an at-will state. So if you have someone who's not using the program correctly, odds are, one, their claim is not going to get paid. And two, as an employer, you'll know that's not a good faith situation. But one of the reasons we don't we're not particularly fond of the referendum language that states exactly how the program will be administered within state government is we want to have a really robust RFP program that says no matter who's administering it, it has a really good, straightforward, simple to use interface that you can go to as an employee or an employer. We have, we all know what the unemployment system was like during the pandemic. We don't want that to be what this is. We want to make sure that we have great staff on the ground, a presence, in Maine, when you call, there's someone to answer the phone to answer your questions. This is a complex program and we need to make sure that the state is stepping up and has a great interface. So that's a lot of information to say. The short version is no, you as the employer are not having to deal with the administration of this program. There are very strict guidelines. You cannot, I got to find a new example, but we've been asked this a few times. You cannot use this program to take leave to take care of your cat or your dog, as much as I love both. This fits within current state and federal law.
But in that same vein, I had been asked this question earlier, that if an employee leaves work either voluntarily or through termination, would they be able to tap into this program and use it as a type of severance? Say I wrap up my employment on the end of December and then my mom lives down in Florida. So maybe I'll go down and hang out with her for a few months.
So a couple of things to unpack on that. The Florida aspect, we're not entirely sure how this will work across state boundaries. We're still trying to figure that out. Some programs have it, some don't. The other thing is the referendum does allow that as sort of like a severance backfill, but they would have to have a legitimate claim. And Kristen, I don't know if you want to kick on what we've been sort of talking about.
I mean, I was just going to say, you know, again, it has to be a legitimate claim. So, I mean, it is possible that somebody would leave work and go take care of an ailing parent in another state. I mean, I feel like that is somewhat reasonable, having been someone in that situation. But again, it needs to be a demonstrated need on the part of that individual to be able to do that. So, I mean, I suppose it could happen, but it's not, you know, I don't think it's going to be I think it's a claim that would need to be authorized by whoever the administrator is.
And I'll also add, unlike unemployment, where, you know, that sort of counts against the employer, that you had that sort of cost that can go back and raise your claim rate. This is not going to be counted against employers. It won't be pulled from their pool. We're all paying into a state fund. I think that's what I'm most passionate about, is that it's not on the backs of employees or employers, that it has, you know, the state trust fund that, you know, is getting pooled from. So let's say an employee was terminated and something happens, they could do that look back period to see if they had qualified in the prior 4, but it's not going to be coming from that employer. It's going to be coming from the state fund,
Right.
and they also have to have a valid claim. So, you know, that I think that can be a little bit confusing, but I think it's important for employers and employees to know that it's not the same mechanism as other existing programs.
We just got another question. This one's a good one, and I'll add to it because the question is, if the employee had short-term disability, but I guess it would go for long-term disability as well, would they be able to collect both?
No. We don't. We had a pretty robust conversation about not only workers' comp, but SSI, and one SSI doesn't kick in for what, 5 months? Am I remembering that correctly, Kristen?
Yeah.
So if they have access to that short-term disability, they have to, one of the other programs has to be the lead one, the
Primary.
Yeah.
We did receive a comment and a question wondering if you have some type of framework or outline about components that are still up for debate or that are still due for further conversation. Is there a document or any point of reference for folks to know what you're looking for additional feedback on?
So we're looking for additional feedback on all of it pretty much. So, you know, again, folks who aren't in the legislative process wouldn't know this, but the bill will be drafted. It'll have a public hearing, and that is when everyone can come out and sort of give their feedback. And then the committee will work the bill. So there's a lot of opportunity for them to take what they hear during the public comment period and build that into what their recommendation is going to be out of the committee and onto the House floor where we vote on it. Because the bill is still being drafted, you know, Mattie and I sort of still have some wiggle room in terms of what we can get put into the bill. But again, everything is sort of, I guess, malleable until it comes out of the committee.
So I just wanted to state for the anonymous question person there, one, here's a copy in the chat of the commission report. Feel free to dig in. The reason we're doing a high level, I know it can seem probably a little bit confusing, is because it's a 300-page report. So we wanted to pull out what we thought were sort of the top line things that could be applicable to members of the Retail Association and Maine grocers and food producers. We'd be happy to do a deep dive with anyone on the call, to go through the whole parameters, but we really wanted to make sure that this is a chance to be responsive to all of you. So for the anonymous question person, the reason we're wanting to respond to questions is it's very rare with laws to be able to have lawmakers turn around and be like, hey, we want to hear from you directly. And so don't think that's coming from an aspect of we don't have everything hammered out. It's that this is a collaboration. This is, instead of doing a top-down approach, it's trying to build something together. If anyone wants to dig into any of the more robust portions of it, we'll be doing, we can link people to the report back we did to the Labor and Housing Committee, as well as happy to share. Actually, all of our meetings are documented on YouTube. So if you really want to do deep dive, you can go along with the commission and see the entire journey as well.
And we're kind of in I feel like a little bit of a weird space, like at this moment in time, because the bill is still in the process of being drafted, but we also want to make sure that we're presenting what information we have so that people feel like they have a voice in sort of what's being drafted. So we're kind of caught in this weird midpoint right now.
And of course, those of us that spend time at the State House, I mean, I don't want to be cynical, but I kind of have to ask, we're almost into April now. If the bill's not out for another couple weeks and then the public hearing a couple weeks after that, we may be looking at probably late April, maybe for a public hearing. That leaves you May and half of June to work through that. Is there any concern that you won't be able to get it done this session? It'll have to be carried over?
We're trying to do everything to not have that happen, knowing that the referendum is out there. I want, for folks who don't live in the legislature, our bills are not drafted by Kristen and myself. We have a nonpartisan staff that write all of the bills, referred to as the revisor's office, with additional help from the Office of Policy and Legal Analysis. We have over 2,000 bills, which has sort of backlogged the entire system. So we are just as anxious as everyone else to have our bill out. These nonpartisan, employees really do the Herculean amount of work for the legislature. So we are literally meeting with them this week. It's a robust bill. We're very lucky that the staff, the lawyers who worked on, the commission with us are the ones drafting the bill, but we are aiming to get this draft out as soon as humanly possible. So, but we are, waiting for their work as well.
And that referendum gives us a good incentive to get it done as quickly as possible.
Yeah.
We did receive in one more question. I think we also want to be respectful of everyone's time as we approach 11 o'clock here. So this will likely be the last question before we wrap things up, but certainly recognizing that the conversation is ever evolving. Last question, is it mandatory for every employee or can people opt in and out of the program?
So it depends on what type of person, and this is one of the things that's up for conversation. So if you're self-employed, you can choose to opt in. You are not required to. If you are a employee of a company that offers a private option, you would not be opting in. So there are mechanisms currently within that to allow an opt-in or an opt-out. We've heard some desire from some folks to be able to have certain business thresholds, have employees be able to opt in or not. So that's sort of where we're hoping to hear some feedback as well. The one thing we've heard from the actuaries, the number scientists, is as universal as it is, the more sustainable the program is and the cheaper it is for everyone. So there's a little bit of those sort of two things. And that's why something like a waiting period is so important, because it helps, bring down the cost of the program as well. And for us, that really is, our, 3 goals. We'll keep saying them: accessible, affordable, and straightforward/simple.
Awesome. And just, I got a last comment and I mistyped it, but just so everybody knows, the potential referendum is not going to be this November. If it does happen, it would be November 2024. So just clarifying that. But why don't we wrap up there? Thank you so much to Senator Daughtry and Representative Cloutier. We really appreciate making the time. I'd like to conclude again by recognizing our series sponsors: Hannaford Supermarkets, Poland Spring, Shaw's Supermarkets, Associated Grocers of New England, Altria, Bazzuto's, C&S Wholesale Grocers, Oakhurst Dairy, Hood, and Pepsi. And thank you to everyone for joining us today. This is going to be an evolving conversation, and we encourage anyone who has questions to please reach out to any of us. Thank you and enjoy your day.
Thank you so much, everyone.
Thank you.
Thank you.